Christopher Karras says he found out the hard way donating blood in Canada comes with strict conditions.
I was just simply told that I wasn't able to donate because I'm gay, and that's just wrong.
Karras decided to fight Canadian Blood Services, which manages the blood supply. He alleges the policy is discriminatory on the basis of sexual orientation. His complaint has been referred to the Canadian Human Rights Tribunal for an inquiry.
I want to see this policy finally eliminated so we can finally talk about issues that are of even more importance.
In the early 1980s, thousands of people were infected with HIV and hepatitis C, infections traced to poorly screened blood from high-risk populations. As a result, gay men were excluded from donating to protect the blood supply from HIV. In 2013, Health Canada changed the criteria from indefinite to a waiting period of 5 years since last sexual contact. In 2016, when Karras filed his complaint, the waiting period was reduced to 1 year. The latest change this year brings it down to 3 months. Men who have sex with men still form the largest single exposure category, but Karras notes government estimates showing they represent less than half of all reported HIV cases, followed by heterosexual contact and intravenous drug use.
With this policy, we're saying that it's legitimate and that it's justified and that we need it to keep the blood system safe, and that just simply isn't the fact.
Canadian Blood Services declined to comment on the case. Its website says the policy is based on science. The agency says it tests every donation for diseases, but there's still a brief period shortly after infection when HIV is not detectable. It says testing would not detect the virus, making a donation infectious to a patient. Karras claims a fair outcome will be applying the policy to every donor or scrapping it completely. The Human Rights Tribunal has not yet announced dates for the inquiry. Ross Lord, Global News, Halifax.